Hi, I'm Kevin Scott, and welcome to 100 Huntley Street. I am excited to be here today with Rajiv Shah, the Director of USAID. Raj, it is so great to be with you today.
Thank you, Kevin. Thanks for having me.
Yeah. Tell us a little bit about your role and the organization and the mission of USAID.
Well, we're the U.S. Agency for International Development. We have nearly 10,000 staff around the world in more than 70 countries. And our mission is very simple. It's to work to end extreme poverty and extreme suffering in vulnerable communities all around the world. So we are proud to carry that mission forward, and I'm excited that it's now possible, really for the first time in decades, to envision the end of extreme dollar-a-day poverty and suffering within just a few decades.
Yeah. Raj, you talk about $1 a day. So what is, define extreme poverty for the viewers?
Well, technically it's people living on $1 or $1.25 a day, but that really is not what it is. What it is it's a condition of human existence that's been around forever, where mothers have to choose between feeding their children and getting a meal themselves at the end of the day, where girls don't go to school but work in the fields, usually on farms, where boys don't get a chance to complete their education and have to start working early in their childhood, and where simple things like getting clean water or having secure shelter or being free from violence and sexual violence and human trafficking cannot be taken for granted because that safety and security simply doesn't exist. And it's hard to imagine, but today, more than 1 billion people, more than 1 in 8 of every person on this planet lives that way. And it just doesn't have to be that way anymore.
Yeah. So, Raj, how do you, the problem seems so huge. 1 billion people living off basically less than $1 a day. What does your organization do? What does USAID do to confront this need? How do you solve a problem that big?
Well, the answer is you pick parts of it and you build partnerships. And so we're proud to work with large companies that can bring technology and new solutions like new vaccines that we've helped to expand the reach to 440 million children over the last decade. That has saved millions of children's lives. So 15 years ago, 12.5 million kids died before the age of 5 from simple diseases, diarrhea, pneumonia, malaria. Today that number is still high, it's 6.5 million. We've made progress, but now we can envision taking it down to virtually zero if we stay focused and if we build partnerships with faith institutions and with companies and scientists and technologists, foundations like the Bill and Melinda Gates Foundation and others.
You use the word partnership a lot, and I think it's important that it's going to take a team effort to do something like this. So there's a lot of different organizations that have to come together. There's a business community and a technology community. And you mentioned a faith community being part of that. What role does the faith community play in combating extreme poverty?
Well, the faith community is essential. When I travel to some of the most difficult places in the world, I walk through a slum in Nairobi, Kenya, called Kibera, and sometimes your shoes are dirty with open sewage and sanitation, and kids are playing in that right there, getting sick, not going to school. And you look around and you say, who is here to help these children lead a better life? And the answer is the church. The answer is a faith-based hospital. The answer is a mission group that has traveled abroad to serve. And that common purpose and that absolute human and moral commitment to really those who suffer the most is why the faith community is essential in the fight to end extreme poverty. And we're proud to have expanded our partnership with communities of faith, with church groups across the world to help achieve that goal.
Yeah. Raj, you mentioned Kibera in Kenya, and I've been there before, and it's mind-blowing, the poverty, or places like Soweto in South Africa. But if I'm sitting in North America, and that seems so far away, how do you help connect people in North America with some of these issues around the world?
Well, we've had a lot of success in connecting communities of faith and others to this mission. First, we have hundreds, thousands of projects around the world that need volunteers. They need folks who want to go and learn and serve and be a part of the effort. And what we find when we attract people to be part of these programs for a little while is it enriches their lives as much as it enriches the lives of the young girl they might help get an education, or the family they might help have enough food to eat. So it's rewarding in both directions, especially for faith communities. So if you're in a congregation somewhere and you want to be part of one of these missions, you can go to usaid.gov, and we would be eager to find a way to partner your institution with local partners and carry out this work.
Is that the best way to get involved? So if I'm sitting at home and maybe I don't have the ability or the financial capacity to take a trip somewhere, what are other ways that I can be involved and I can help in the fight to end extreme poverty?
Well, there are a lot of other ways. First, it is possible now to go online and engage and become an advocate to learn these issues and to speak about them with your friends and family. It's actually critically important that more Americans, Canadians from all over the world get engaged in this effort, talk about it, and vote, and engage with public leaders and members of Congress and others to make sure that people prioritize this. You know, it's true that a handful of countries have led the world in humanitarian effort over the past decades, but right now there's a lot of political pressure to cut budgets, to do less of this. And what we find when we do that is we're not living out our values, and we're not expressing who we are to those who are most vulnerable. So your voice is as important as your feet if you want to, if you're not able to go and be a part of the programs directly.
Okay, something that's very fascinating to me is this idea of microgrants and people giving small amounts of money that mean a whole lot in other places. What do you think about those types of programs, and is that something that we should invest in?
Absolutely, they're fantastic. The benefit of that is that you can give $25 on kiva.org or some other web-enabled platform, and you can find a young female business leader or innovator somewhere, and your resourcing allows her to do a little bit more and move herself out of poverty. And what is really telling about it is that you don't have to do things for people. All we're trying to do is give people the tools and the capabilities to use their own hard work and ingenuity to move themselves out of poverty. And when we've done this, we've been hugely successful. Over the last few years, we created an effort called Feed the Future. Today, we're reaching 7 million farmers with better agricultural technologies and practices, and 12 million children in those households that used to go to bed hungry every night no longer do. And it's not because anyone gave them food, it's because we all help their families aspire for a better future.
Yeah, that's remarkable. Really, really cool. I want to shift gears just for a minute, because I know that one of the things that goes hand in hand with extreme poverty is disease a lot of times. And the world has a lot of attention right now on Ebola and the outbreak and the epidemic, not only in Western Africa, but now spreading to other places around the world. Can you kind of give us an update on what's happening and what you've seen and heard around this issue?
Absolutely, and our teams are on the ground in West Africa, in Liberia, Sierra Leone, Guinea, coordinating and managing what we aspire to be a strong and effective international response. You know, this started with tens of cases, and then it went to hundreds. Now it's thousands, and so we are acting aggressively to make sure that we break the chain of transmission and save lives. And the truth is, we're going to succeed. We're going to succeed by getting hundreds of thousands of sets of protective equipment into the region so medical providers can be safe themselves. We're going to succeed by mobilizing households and communities so they have protective equipment. They're spraying down surfaces with chlorine. They're not handling dead bodies with their hands, which has been a real source of transmission. And we're going to succeed in cutting transmission in communities that way. But in order to be successful, we need to do more, and frankly, we need more healthcare workers. So if you're a trained healthcare worker and you want to be part of the effort, please go to usaid.gov. We can assign you to one of our partners. You can get compensated for your service, and you can be part of an effort to help prevent this terrible disease from killing more innocent people.
Let me ask you this, Raj. If I'm sitting at home in North America, do I need to be worried about the epidemic? Do I need to be worried that it's going to spread here and affect my kids?
Absolutely not. Our CDC director, Tom Frieden, was very clear that we can stop this disease in its tracks in the United States. That's true in Canada. It's true in most industrialized countries. And it shows you that when you have a modern and effective public health system, these diseases, which actually are not that easy to transmit from person to person, don't ravage our communities, and they don't kill our children. And a 4-year-old who gets the disease isn't left to die on the street where no one can go near her to help her or touch her. That happens in countries where we haven't made the investments in building health systems, in giving poorer communities a chance to aspire to more on their own behalf. And had we been making those investments in Liberia, in Guinea, in Sierra Leone, and more aggressively over the last decade, we wouldn't have this challenge right now.
Okay, so we're definitely very fortunate, very blessed in North America to not have some of these same challenges. So to kind of circle back to where we started, there are 1 billion people around the world living in extreme poverty. If I'm sitting at home, I'm watching my TV, what's the best way to help? What's the most effective way for a person of faith to get involved and help make a difference?
Well, I would say you could go to our site at usaid.gov and register and be a part of our movement. And some people who do that will end up on missions out in programs and projects somewhere around the world, and your service will be greatly appreciated. Others who do it might just learn more about these problems and advocate for more resources and more visibility for these challenges. But if we can increase the global consciousness of the plight of those who are vulnerable and those who suffer, we can actually end this problem once and for all. And that's a really unique thing, to be able to say that a condition of human existence that has been with us for millennia can actually come to an end in 15 years because of technology and business and partnership and faith. That's very powerful. There are very few things on earth where we can say that. This is one of them, and we really would seek your support.
Raj, you've been speaking to faith-based groups a lot lately, or just around the idea of getting faith involved. Can you tell me what are some of the other things that you're passionate about, or things that you'd like to see change?
In the faith community?
Yeah, within the faith community and within just the global network as far as how we confront these issues.
Well, we used to confront these issues just by spending money. And you'd say, okay, if you need to build a road somewhere, you'd hire a contractor, build a road. The new way, the new model we now use to confront these issues is to say, let's get our best faith leaders, our best scientists, our best business leaders together and figure out, how do you get clean water to 700 million children who don't have access to clean water? Sometimes that's new water filters that can be cheaply produced, invented on college campuses in North America, and then produced all over the world. Sometimes it's large-scale public-private partnerships where we have dozens of agricultural companies making billions of dollars of investments alongside our efforts to scale the effectiveness of them. And sometimes it's getting church communities, small and large, to get their congregations to be aware, to take up collections, and ultimately to go and be a part of these programs and reach those very, very vulnerable communities themselves. So there are lots of ways to solve these problems, but the old model is a bit dated. We've transformed the way we work, and that's why we seek new partners everywhere we go.
Wow. Well, Raj, thanks so much for telling us about this. I think it's so important for us to get involved, especially as members of the faith community, as Christians. God has called us to go and to help serve the least of these. So thank you for your time and your work, and we appreciate you being with us today.
Thank you.